Columbus Small Animal Hospital, loving our work. I'm Dr. Jim Kramer. This is Copper. He's just a 3-year-old neutered male long-haired dachshund. You can see that he has a big problem. Copper was having problems with his hind legs and was treated elsewhere for a week before being referred to us. This is a situation with a poor prognosis. Poor Copper has virtually no use of either hind leg, no use of his tail, no anal tone, no bladder tone in his urinary bladder, no voluntary control of his bladder. He's completely paralyzed. 1 week duration. This looks pretty hopeless. It's really hard to watch these animals struggle when their head and neck and front legs and their mind works perfectly, but their hind legs just aren't cooperating or much of anything in that area. So we spring into action. We give Copper the full broadside, the back dog protocol, which involves many different modalities, lots of different treatments, lots of different kinds of treatment, certified acupuncture, class 4 therapeutic laser, physical therapy, hydrotherapy, homeopathy, and Western pharmacopoeia. So here we see Copper enjoying one of many class 4 therapy laser treatments. And here he is with some hydrotherapy and swim therapy using the buoyancy of water to help him. And now another of many certified acupuncture treatments. My wife, Dr. Ann, is one of the few certified veterinary acupuncturists in the state. Our animal patients tolerate this surprisingly well. Many fall asleep during the treatments. So we utilize physical therapy to try to regain confidence in the animal that poor Copper here could possibly walk again. We see no action with his tail, not much volunteer control of anything in his posterior hindquarters. But as long as there's a glimmer of hope, we're going to keep trying. As long as Copper will keep trying, and there's a possibility for success, we're going to keep working at it. And here we see Copper beginning to stand a little bit on his hind legs with some help. But when he tries to advance his legs, he has complete proprioceptive deficits on both hind paws. They knuckle over, just drag behind him. He cannot place them. He can't put the walking surface underneath like it's supposed to be to lift and place his paw. He can stand a little bit when he's propped up, but he can't begin to take a step or walk yet. So we're starting to see a glimmer of hope, so we stay at it. More acupuncture, more therapeutic laser, more physical therapy, more medication, more of everything. And we're starting to see a glimmer of a possibility of distant hope for some kind of a successful outcome. So now we've been at this for 10 days, and Copper's actually starting to walk. You can see not normally. He does knuckle over, especially on that right hind leg. But if he hops using them together, he can locomotor pretty well. They're not under his complete control, but far better than they were before. And he started to urinate on his own. So that's a very, very good prognostic step. Sometimes the dogs regain their ability to walk on their hind legs, but never regain the ability to urinate voluntarily. And so we continue treatment. So 14 days after admitting Copper in a situation that looked pretty bleak, he makes such a good recovery that he's able to go back home, walking on his hind legs, controlling his urination, urinating voluntarily, has use of his tail, and he comes back to see us 2 months later. And this is what Copper looks like now. Copper's only 3 years old, has his whole life ahead of him. Happy dog, happy owner. Columbus Small Animal Hospital, loving our work.